Thanks for joining us today. I'm Jen Harris with Montgomery County, and of course joining us is Dr. Bissell. She's here to talk to us for a little bit and then answer any questions you may have, give us an update. If you have any questions, please feel free to ask those in the chat or the Q&A. Thank you so much.
Hi, thank you, Jen, very much. Let me see if this makes the lighting a little bit better there. I'm in a different place today doing our press briefing. So good afternoon, everyone. Thanks for joining us today. We're moving to the end of the year holidays with COVID once again forefront in everyone's mind, right? So families are trying to plan safe and healthy ways to celebrate the holidays. And our community is trying to keep our healthcare systems from being overwhelmed so they can be there for everyone in their time of need. Meanwhile, Omicron is making a lot of waves around the world. It will likely be the predominant variant in the United States within the next few weeks. It's extremely transmissible, and cases in the places where it has overtaken Delta are doubling every 2 to 3 days. So we'll start right now with where we are here in the New River Valley. We have our epi curves. And I think the first one to come up, here we go. So for the district, you can see that we had our Delta surge in early September, came down, but now cases have started to bump back up and kind of hanging right there around 300, between 300, 350 cases per week. And then if we go on to each of the localities, kind of a very similar presentation. Montgomery County, obviously our largest county, right there with the majority of the cases for the district. They also have the largest population. And remember that last bar on the right is going to fill in as we collect more information. Moving on, each locality, and again, I tell you to look at the y-axis. When we get to our smaller localities, the y-axis is in the tens and not in the hundreds. So those bars may look a little bit more extreme, but you're talking 10 cases versus 50 or 100 cases. So that's Radford. And then we go to Floyd, same thing. Kind of had that peak in September, came down and had a little bit of a jump there. The end of November, early December, and we're kind of right back in there around the 40 cases a week. I think Giles is next. Same thing, kind of seems to have plateaued, maybe starting to see a little bit of an increase there. And then Floyd, or Pulaski, I'm sorry. Same thing, Pulaski was kind of stubborn with starting to come down. Now those cases seem to be going back up just slightly again. And then we can look at our school-age children. And remember, our school-age children mirror what's happening in the community. So we saw the spike with the Delta cases in early September and then has come down. And the next graph actually shows, you can see our college students, again, not a significant contribution to our case numbers, but our community is the majority. And then when our community cases are going up, our school age cases are. As community cases come down, school age cases come down. And again, that's not unexpected because most of the transmission does occur in the household. In the New River Valley, we are still predominantly dealing with the Delta variant and the bump, as we saw from the cases in holiday gatherings and engaging in more activities inside due to the cold weather. This morning, our hospitals reported 38 COVID positive patients, about the same as last week. But our hospitals are still very busy with everything else. They often have they're full inpatient and have patients waiting in the emergency department for beds to become available. So we continue to ask people to choose behavior that reduces the spread of infection and protects our healthcare system. You know, they're taking care of everything. And when we add the burden of COVID, that stretches them even thinner. As I said, we do expect cases will increase significantly in the New River Valley over the coming weeks as Omicron arrives. You know, case numbers are becoming even less reliable now as more people do in-home tests or at-home tests and aren't reporting results. Also, as people assume they have COVID and don't get tested, or they attribute their symptoms to something else and don't get tested. Rapid testing availability is slowly improving. We do ask people who do rapid tests, whether they're positive or negative, to report them to the health department. There is an online portal. And the health department continues to have good PCR availability. I'll discuss it later on, but we have modified our schedule due to the holidays these next few weeks. But as I mentioned before, at this point in the pandemic, we really need to be shifting to looking more at hospitalizations, deaths, and trends. And we just went through our epi curves. One thing, Jen, do we have the other slides for vaccinations versus?
We do. Stand by. I'll pull those up.
I did want to show some additional slides which tell a very important story. If you look at, and this is the United States, Virginia, Tennessee, Southwest Virginia, if you look at the percent of the population that's fully vaccinated, and then you look at the deaths per 100,000, and this is since September 1st, so since our Delta surge, you can see that it's inversely correlated. So in other words, Virginia actually as a state is doing very well overall because our percent of the population fully vaccinated is pretty high. But then when you look at Southwest Virginia, the vaccination rates in Southwest Virginia and Northeastern Tennessee are on the lower side, and the COVID deaths in those areas are on the higher side. So again, that just highlights that what we are seeing is our vaccines are still very protective against severe disease, hospitalization, and deaths. And that's the important thing. That's a public health success. Not surprisingly, all of the communities in the New River Health District are still considered to be at high community transmission as defined by the CDC. We expect that's going to stay that way for a while as we get through the holidays with gatherings and then we encounter the Omicron variant. Please remember, as we keep reminding, that the Virginia Department of Labor and Industry requires that employers mandate indoor masking in areas of substantial or high transmission, regardless of distancing and vaccination status. So that's pretty much everyone. We're living this pandemic real time. I think I've said that many times, and we'll continue to follow things closely as things evolve. But there are encouraging signs that Omicron does not cause a serious disease as prior variants. The data from South Africa shows that about 1.7% of Omicron cases end up hospitalized, whereas it was about 19% of Delta cases. And their director of their infectious disease organization, similar to the CDC, said that the length of stay in the hospital for people under 40 is 3 to 4 days, and for those over 40, it's 4 to 5 days, which is much shorter overall than prior variants. Right now, with the Delta variant, we see patients who are hospitalized for weeks. New York City and some areas on the West Coast are definitely seeing Omicron start to pick up, much more prevalence. And so far, they're not seeing as many hospitalizations as with previous variants. But again, something we know hospitalizations can lag behind, so we'll continue to have to follow, we'll have to continue to follow that. We do have to remember that as Omicron is so much more contagious, that more people are going to get infected. And so we may see absolute numbers of hospitalizations and deaths going up, because even a small percentage of a very large number is still a lot of people. The good news is that the vaccine still looks like it's very protective against severe disease, hospitalization, and death. Although Omicron may infect people who've been previously infected with other variants, vaccinated, or even boosted, the data we're seeing from South Africa and the United Kingdom indicates that the vaccine is working. In South Africa, 93% of the deaths have been in people who are unvaccinated or partially vaccinated. So being vaccinated, as we have said, significantly reduces hospitalizations and deaths. That's a win for everyone, and it protects our healthcare systems. So we're continuing to encourage everyone to get vaccinated. Vaccines are widely available at local pharmacies, chain pharmacies, medical practices, pediatrician practices, and of course at the health department. We offer vaccination clinics every weekday at different facilities. Please note this Thursday and Friday, December 23rd and 24th, and next Friday the 31st, the health department is closed for state holidays and there will be no vaccine clinics. This week, we are at the Montgomery County Health Department today, tomorrow, and that's until 3:30. Tomorrow we're in Floyd from 8:15 to noon. Wednesday, 8:15 to 3:30 in Pulaski and Giles. Please call 585-3300 to make your appointment. You can also check the schedule on our NRV roadtowellness.com website. You can also check vaccinate.virginia.gov. That will have our clinics listed, as well as our local pharmacy clinics and our chain pharmacy clinics. So I think it's important, we have to accept COVID's here. It's not going to go away. The CDC late last month did acknowledge that we aren't going to achieve that herd immunity. We aren't going to eradicate COVID. So that means we're moving to where COVID's endemic. As one person said in something I was reading, we have to learn to dance with COVID. This means that each individual, each household, each family needs to perform a risk assessment to inform their own behavior, just like we do with flu and other diseases spreading in the community, just like we do with all the activities that we do. So just like with flu and other infectious diseases, we have safe, effective vaccines, and we have treatments now, and more treatments are promising coming to the market soon. So the pandemic has also shown us the value of non-pharmaceutical interventions, such as masking and ventilation, respiratory hygiene, and hand washing. So hopefully those are some of the tools that we'll continue to use, whether it's COVID or flu or hepatitis A or any other communicable disease. The big question people are asking is obviously about how to plan safely for family get-togethers over the holidays. And again, this is where everyone has to do their own risk assessment. You have to ask who is gathering. Is it very young people who can't be vaccinated, very old people who even with a booster still are at higher risk, immunocompromised people? You have to kind of look at who's going to be there and then make those decisions. Obviously, outdoors is always better. So if the weather's milder, or even if it's a little bit cooler and people can bundle up, outdoor is better. Inside, try to avoid any basement areas with poor ventilation, be in more wide open areas where maybe doors, windows could be opened a little bit to allow for better ventilation. Anyone with symptoms should definitely not attend any kind of gatherings. Use good respiratory hygiene. Don't cough and sneeze into the air. Cough or sneeze into the angle of your elbow. Wash your hands. And then obviously, you can always mask indoors, even at a family gathering. A double layered, well-fitting cloth mask or surgical masks, which are readily available now. Some folks are choosing, and the CDC does recommend consider testing before gathering. As I said, rapid tests are becoming more available, and we do have our testing at the health department, which obviously we're winding down for this week. We will be testing again next week, and it's not unreasonable to go ahead and get tested in advance, and certainly test after any gatherings. Certainly those who are younger and healthier and at lower risk, they have more of a risk tolerance than those who are gathering with others who are on the extremes of age and maybe at higher risk. But as always, no matter what, anyone who has symptoms, please stay home from anything, whether it's a family gathering, whether it's work or school or holiday shopping, running errands, please stay home if symptomatic. Our rapid tests, as I said, are becoming more available at pharmacies. Our schedule this week, we tested today. Tomorrow we'll test from 9 to 11:30 in Floyd. The lab is closed the remainder of the week, so we can't test the rest of this week. Next week, we're from 9 to 11:30 Monday at Montgomery and Tuesday at Floyd. On Wednesday, we will be back at Montgomery from 1 to 3 in the afternoon, and then we won't be testing on Thursday and Friday. I think the last thing is that we're going to change how we're doing our press briefings. We won't be meeting next week or January 3rd. Starting on January 10th, I'd like to hold office hours where we aren't so much presenting a statement and then taking questions, but I'm available virtually on Mondays at the same time from 2 to 3 for any questions, for anyone to stop in virtually and ask any questions and have a discussion. And we will continue to use our NRV Road to Wellness website as a way to communicate and post our EpiCurves. So I'll go ahead and take questions now.
Okay, we have a few that have come in. I know you addressed this a little bit when you were giving your update, but what are some specific precautions that you think folks should just in general do to stay safe over the holidays from COVID and this new variant, not just this week, but through New Year's?
So it's, no matter what variant it is, whether it's Delta, which is still predominant here, versus Omicron, which will be predominant sooner rather than later, the same precautions work. I think, the first thing is get vaccinated. And even though we're coming up on the holidays and we don't have that full 2 weeks, certainly go ahead and get vaccinated, because your body will start developing that immunity, as soon as you get vaccinated. So go ahead and start the process if you haven't done so already, because that will be helpful. Anybody who is symptomatic, please obviously stay home. And I know that requires changing plans, which is not something we want, but it's a lot better this year than we were last year because we do have vaccinations. So, let's try to keep things controlled this year, and hopefully by next year it'll be even better. And then, as I said, outdoors is better than indoors. So any outdoor activities, especially if the weather is milder, would be the best thing when you're gathering. And if you can't, try to make those indoor ones in larger, better ventilated spaces, and don't throw the masks away. I know, that can be a touchy subject with some people, but especially if you are gathering with higher risk individuals, that is something that can really help to keep everyone safe, and know who you're gathering with. And certainly, I would say in the week prior to doing those gatherings, watch what your behavior is and try not to do anything super high risk, crowded public spaces, bars, those kinds of things, where you're more likely to be exposed. And then good respiratory hygiene, good hand hygiene. Those are always good public health precautions.
Okay, let's see. The next one is, what kind of supplies should people go ahead and gather if possible in case they do have a COVID infection in their household? Do they need a pulse ox? Do they need over-the-counter medications? What kinds of things would you recommend that they do? And also, if someone does test positive, I know you mentioned not everyone, you can be testing at home. There's other ways you can do it. What's the first thing you should do in addition to getting the supplies? You need to isolate. What's a good thing? What's a good barometer for folks to have at this point?
So, this is a viral illness, just like so many other viruses that we get. I don't think a pulse ox is necessary unless somebody has higher risk conditions, people with other medical conditions that put them at higher risk. Some of them have gotten pulse ox machines, but for most healthy people who are not immunocompromised, they don't need a pulse ox at home. Certainly over-the-counter medications. You can do the ibuprofens or the acetaminophen to help with the aches and pains and the headaches and the fevers. Your antihistamines and decongestants for any cold-like symptoms, cough medicines. Personally, I like hot tea with honey for sore throats, those kinds of things. Saltwater gargles help with sore throats as well. So it really is about symptomatic things. You want to be eating well, you want to be staying hydrated, you want to get plenty of rest, you want to do everything you can to support your body's immune system as it's fighting the infection. Yes, certainly if someone does test positive, they want to isolate from the from the onset of symptoms, the positive test, whichever of those days is first, and try to, even within the household, try to stay away from other folks. Try not to eat at the same table. Try to just keep the distance within the household. And obviously those things vary a little bit for those who are vaccinated or unvaccinated, but because Omicron does spread pretty easily, and we know household transmission is also extremely common, we really do want to try and isolate ourselves within the household as much as we are able to do that. Those who test positive, isolate and symptomatic treatment, but certainly again, those who might be older or higher risk or immunocompromised, get in touch with your physician to talk about monoclonal antibodies and some of the therapeutics, because those are extremely effective in preventing deterioration to where someone needs to be in the hospital. So, that's where we shift into those therapeutics. So get in contact with your doctor and discuss it with them and decide whether or not your physician feels like, you're a candidate for monoclonal antibodies or you need the monoclonal antibodies, those are still looking promising with Omicron as well. And certainly, if you don't have a physician, the community health center, the Pulaski Free Clinic, or call in the health department, and we'd be happy to help you.
Thank you for that. There appears to be about 5 questions left in the queue. Again, if you have any questions, feel free to ask them in the chat or the Q&A. So Tom is asking, statewide, we are approaching 10% positivity, a 10% positivity rate. And with the Omicron and the holiday social gatherings, are we likely to greatly exceed that rate?
You know, the positivity rate depends on who's getting tested, right? It depends on the number of tests that we're doing. And again, as we do more and more home tests, if we don't get those results reported, that can skew the results. But yes, I mean, I think in general, you know, as our case numbers go up, which we do expect them to from the Omicron variant, you will see that percent positivity going up. So we do expect to see things climb as the Omicron variant hits the area and circulates. And of course, we do have Omicron detected in a couple of areas in the state. That was announced late last week.
Okay. So Alexis is asking, are you worried about the rising cases due to the holidays? Centra saw an uptick from December to January last year.
You know, I think we're in a better place than we were last year. You know, again, I think we need to, I really do, and there's lots of public health professionals who feel that, you know, we are in a place where this is a communicable disease for which we have a very effective and safe vaccine that really in the areas that have high vaccination rates, it decouples, the case numbers actually decouple. You know, they diverge from the hospitalizations and the deaths. And that's, you know, I think we're at the point right now that it's spreading and we can't put the genie back in the bottle. You know, stopping transmission right now is really, really challenging. So we look at those outcomes. So I do think we're in a much better place because we do have the vaccines. So I think we're in a much better place than we were last year. Now, will the cases get as high as they were last year? They might even pass last year because remember, this one is more transmissible. But what we're hoping is that because it does at this point look like those hospitalizations and deaths will be much less, that we can weather the storm and that our healthcare systems can weather that storm as well. And we won't see, you know, that's when we first started this whole thing. Remember, we talked about flattening the curve, and the whole flattening the curve wasn't really to make the virus go away. As we've said before, a virus gonna virus, and this is what viruses do. But it was more to spread out the infections so that we don't overwhelm our healthcare systems, so that they're still there to take care of COVID infected people, but also everyone else who has all the other medical issues that needs them. So hopefully the number of cases, as I said, that 1.7% or 2% hospitalizations, if that number gets high enough to where we have that high number of cases, we could certainly see a significant number of hospitalizations. But I think, you know, the fact that we have the vaccine, we have people who have been infected, and that's going to help keep the severity down. And it looks like it is that way.
All right, Gina's asking, are you worried that people won't take this new variant seriously enough as they gather, since the symptoms seem to be much more mild? So Omicron.
Well, you know, I mean, I think there are a lot of people who are essentially done with the pandemic. So whether or not they take Omicron or any other variant as seriously, you know, they are ready to move on from the pandemic. So yes, that is a concern. I mean, we still do have to take it seriously. We still have to promote vaccination because, you know, it's just been a tremendous feat that we have such safe, effective vaccines in a record time to really help kind of change the course. So we continue to promote vaccination and try to dispel any myths, or, you know, get to the root of any misinformation, and then just encourage people. You know, communicable diseases are always around, and anybody can get infected with them, and anybody can have serious outcomes from them. And there are some basic prevention techniques that work really well. And so we just try to encourage people to follow those, and keep themselves and keep their communities safe. And you know, we'll just be here and continue to try and do all those things. But I do think there are a substantial number of people who are over the pandemic, and I'm hopeful that they can at least do the simple things to help protect themselves.
All right, it appears that we have about 3 questions left in the queue. So if you have any questions, feel free to ask them in the chat or the Q&A. Nick is asking, Omicron hasn't been discovered anywhere locally yet, correct? And will sequencing be delayed by the holidays?
We do not have it in the Southwest region. To my knowledge, we announce it by region. So I can't say specifically New River, but Southwest we do not. There will be some sequencing delays in that the labs are closed a little bit over the holidays, but really just a day or two. So and it does take time to sequence. So I don't expect there to be massive delays. It may be a day or two, but we will get, for instance, the samples that are being submitted today and tomorrow, they will take select ones of those and they will go ahead and sequence them. We won't be testing on the rest of the week, but then we'll pick up testing again early next week, and those samples will get tested before the New Year's weekend, and they'll get, the samples will be sequenced. The state lab is sequencing, our lab Fralin is sequencing, the VCU, all of the one labs, VCU and the UVA labs are sequencing. So, there will be a little bit of a delay because there are going to be some closings for the holidays, but not significant. And again, the reality is that no matter what variant it is, we know what works to protect us and to protect our families and our communities. And we're still trying to push vaccination.
Okay, Eric asks, the daily average is approaching 3,000, and it looks like we could exceed the number of cases we saw from the Delta variant in September. So how many cases can we expect to see in Virginia on this current wave?
I honestly don't know. It is more transmissible than Delta, so we could definitely see a larger surge now. We do have a lot more people vaccinated, and we do have a lot of people who have immunity from prior infection. And while we do see breakthrough cases with those who are vaccinated, and we do see reinfections, not everyone is going to have a breakthrough case or have a reinfection. So, it's really depends on the number of susceptible people. And again, as I said, counting cases, I'm not sure that's really just not as meaningful. If you have a very mild breakthrough case that's like a cold, we don't count cases of the cold. We don't count cases of flu anymore. So I think we really need to look at how we are measuring the progress in the pandemic, and that really needs to shift to those outcomes. We'll look at the trends, we'll look at the hospitalizations, we look at those deaths.
Okay, Nick had a follow-up question. He'd asked about whether or not it was in our region and about the sequencing. So following up on the previous question, is it safe to assume that this current rise in cases is tied to Thanksgiving gatherings?
Yeah, right now, the predominant strain in our region is still the Delta variant. So yeah, I think the rise in cases is a combination, as I said, of the Thanksgiving gatherings and just in general, more indoor activity. As the weather gets colder, people tend to spend more time indoors, whether it's a gathering for the holiday or it's just a few people getting together, watching the football games, game day, whatever. So just indoor gatherings and certainly holiday gatherings. And as I said, right now, our predominant strain is still Delta, but we do expect, we know it's here in the state, we know it's in pretty much every state, so it's going to make it to us sooner rather than later, and we do expect within a matter of weeks that Omicron will replace Delta as our predominant strain.
Okay, this appears to be our last question. So again, if you have any questions, now is the time to ask them in the chat or the Q&A. So as folks are preparing to travel on everyone's mind. If someone is, if let's say the grandparents are going to visit their daughter and they've had a booster shot and a flu vaccine and they have 0 symptoms, would you still recommend them testing before they go for the visit to their relative's house?
So I think the more important thing is the grandchildren and the younger folks in the family to make sure that they get tested if you're going to test, because they're probably the ones that have been a little bit more active and social and whatnot at higher risk of exposure. Although certainly if the grandparents, get out and do things, go play bridge, go, and socialize, then yeah, again, it's really a matter of what your behaviors have been. Certainly people who are getting out and doing things, I would advise testing much more so than people who really aren't out much and are home. It's all part of that risk assessment, and you have to evaluate your behavior. And like I said, if we're planning to gather in the days to week before we do gather, it's smart to really decrease the risky behavior that we might be engaging in, and not going out to the bars and restaurants or crowded public gatherings, and try to minimize that.
Okay, I see no more questions coming in through the chat or the Q&A. So this appears to be our final call for this 2021, and we shall see everyone again next year. Take care,
Yeah.
be safe, be well.
Jen, thank you. I want to thank Uncork It for their help. We're going to transition to a little bit of a different way, but I think we have to make that transition to endemic. Have a wonderful, safe holiday, everyone. I hope people can get some relaxing time and have a nice time with those family and friends that they choose to spend it with, if they are getting together with others.
Thank you. Take care, everyone.
Thanks, everybody. Bye-bye.